Question 1. Implementation of a new health insurance policy requires the health insurance professional HIP to determine if a policyholder's claim for a specific benefit has been triggered. The policy defines the benefit trigger as medically necessary treatment for a chronic condition requiring ongoing management, as documented by a specialist physician. The policyholder submits a claim along with a letter from their general practitioner stating they are experiencing significant discomfort and require treatment. Which of the following approaches best aligns with regulatory requirements and best practices for determining if the benefit trigger has been met? Option A. Approving the claim based on the general practitioner's letter, as it indicates the policyholder is experiencing discomfort and requires treatment. Option B. Contacting the policyholder to obtain a self-declaration of the chronic condition and its ongoing management needs. Option C. Requesting a detailed report from a specialist physician outlining the chronic condition, its ongoing management requirements, and the medical necessity of the proposed treatment. Option D. Denying the claim immediately due to the absence of a specialist physician's report, prioritizing efficiency. The correct answer is C. Requesting a detailed report from a specialist physician outlining the chronic condition, its ongoing management requirements, and the medical necessity of the proposed treatment. Explanation. This scenario is professionally challenging because it requires a health insurance professional, HIP, to balance the insurer's need for clear, objective benefit triggers with the policyholder's expectation of coverage when experiencing a qualifying health event. Misinterpreting or misapplying benefit triggers can lead to claim denials, policyholder dissatisfaction, and potential regulatory scrutiny. The HIP must ensure that the application of these triggers aligns with both the policy contract and relevant regulations governing health insurance claims processing. The correct approach involves a thorough review of the policy contract's specific language defining the benefit trigger, coupled with an objective assessment of the medical evidence presented. This approach is correct because it adheres to the principle of contractual obligation and regulatory compliance. Benefit triggers are contractual provisions that must be applied as written. Regulatory frameworks for health insurance typically mandate fair and prompt claims handling, which includes accurately applying policy terms. By focusing on the defined trigger and objective medical evidence, the HIP ensures that the decision is based on established criteria, minimizing subjective interpretation and promoting fairness. An incorrect approach that relies solely on the policyholder's subjective statement of need, without verifying against the defined benefit trigger and objective medical evidence, fails to uphold the contractual terms. This can lead to inappropriate claim approvals or denials, violating the insurer's obligation to adhere to the policy contract and potentially contravening regulations that require claims to be processed based on policy provisions and supporting documentation. Another incorrect approach that involves prioritizing expediency over accuracy by approving a claim based on a preliminary, unverified medical report risks approving a claim that does not meet the benefit trigger. This can result in financial loss for the insurer and create a precedent for inconsistent claims handling, which is often viewed unfavorably by regulators. A further incorrect approach that involves denying a claim solely because the medical documentation is complex, without making a diligent effort to understand and apply the benefit trigger to the presented evidence, demonstrates a failure in due diligence. This can lead to an unfair denial, potentially violating regulations that require insurers to investigate claims thoroughly and make decisions based on a complete understanding of the facts and policy terms. Professionals should employ a decision-making framework that emphasizes a systematic review of the policy contract, objective assessment of all submitted evidence against the defined benefit triggers, and adherence to all applicable regulatory requirements for claims processing. This includes seeking clarification on ambiguous policy language or complex medical information when necessary, and maintaining clear, documented rationale for all claims decisions. Question 2. Which approach would be most appropriate for a health insurance professional, HIP, to determine whether a specific medical treatment is covered under a policy that contains an exclusion for experimental or investigational treatments, when the insured has provided documentation suggesting the treatment has shown some promising results in early studies, but is not yet widely recognized by the medical community? Option A. The HIP should consult the specific wording of the experimental or investigational treatments exclusion in the insured's policy, research current state insurance regulations regarding the definition and application of such exclusions, and investigate whether any established medical guidelines or peer-reviewed studies support the treatment's efficacy and safety. Option B. The HIP should deny the claim based on the general understanding that treatments with limited study results are typically considered experimental. Option C. The HIP should immediately forward the claim to the underwriting department for a final decision, without conducting any initial review of the policy or supporting documentation. Option D. The HIP should approve the claim to avoid potential customer dissatisfaction, regardless of the policy's exclusion language. Correct answer is A. The HIP should consult the specific wording of the experimental or investigational treatments exclusion in the insured's policy, research current state insurance regulations regarding the definition and application of such exclusions, and investigate whether any established medical guidelines or peer-reviewed studies support the treatment's efficacy and safety. Explanation: this scenario is professionally challenging because it requires the health insurance professional HIP to balance the insurer's contractual obligations with the insured's reasonable expectations and the legal framework governing health insurance policies. Misinterpreting policy provisions can lead to claim denials, customer dissatisfaction, and potential regulatory sanctions. Careful judgment is required to ensure adherence to both the letter of the policy and the spirit of consumer protection laws. The correct approach involves a thorough review of the specific policy language, relevant state insurance regulations, and any applicable case law that interprets such provisions. This approach prioritizes accuracy and compliance by directly addressing the policy's terms and the governing legal landscape. Specifically, it requires the HIP to identify the exact wording of the exclusion, determine if the condition falls within its scope, and assess whether any exceptions or waivers might apply based on the policy and state law. This meticulous examination ensures that the decision is legally sound and ethically defensible, upholding the insurer's duty of good faith and fair dealing. An incorrect approach that relies solely on a general understanding of common exclusions without consulting the specific policy language is professionally unacceptable. This fails to acknowledge the unique terms and conditions of the individual contract, potentially leading to an erroneous denial of a valid claim. It also disregards the regulatory requirement for insurers to act in accordance with their policy contracts. Another incorrect approach that involves making a decision based on the insured's perceived financial hardship rather than the policy's terms and legal framework is also professionally flawed. While empathy is important, insurance decisions must be grounded in contractual obligations and legal compliance. Basing a decision on factors outside the policy's scope can lead to inconsistent claim handling and may violate principles of fairness and equity among policyholders. Furthermore, it could be seen as an attempt to circumvent policy provisions, which can have regulatory implications. A further incorrect approach that involves deferring the decision to a supervisor without conducting an initial thorough review is inefficient and demonstrates a lack of professional responsibility. While seeking guidance is appropriate in complex cases, HIP is expected to perform a foundational analysis of the policy and relevant regulations before escalating. This initial review is crucial for providing the supervisor with the necessary context and for demonstrating due diligence. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the core issue. Clearly identify the reason for the claim denial or coverage question. 2. Review the policy. Meticulously examine the specific policy language, including definitions, coverage grants, limitations, and exclusions. 3. Consult relevant regulations. Identify and review applicable state and federal insurance laws and regulations that govern policy provisions and claim handling. 4. Research case law. If the policy language is ambiguous or has been subject to legal interpretation, research relevant court decisions. 5. Apply facts to policy and law. Objectively determine if the insured's condition or treatment falls within the scope of the policy's coverage or exclusion, considering all legal and regulatory factors. 6. Document the decision. Clearly articulate the rationale for the decision, referencing specific policy provisions and legal authorities. 7. Seek clarification or escalation when necessary. If ambiguity persists or the situation is particularly complex, consult with legal counsel or senior management, providing them with a comprehensive analysis. Question 3. The analysis reveals that a patient presented with symptoms of shortness of breath and a cough. The physician's progress note states, Patient exhibits signs of respiratory distress, likely pneumonia. The physician has not yet ordered further diagnostic tests to confirm the diagnosis. As a health insurance professional HIP, what is the most appropriate ICD coding action? Option A. Sign an ICD code for pneumonia only after diagnostic confirmation and physician documentation of a definitive diagnosis. Option B. Assign an ICD code for pneumonia based on the physician's stated suspicion. Option C. Assign an ICD code for unspecified respiratory distress. Option D. Assign an ICD code for shortness of breath and cough as symptoms. The correct answer is B. Assign an ICD code for pneumonia based on the physician's stated suspicion. Explanation: this scenario is professionally challenging because accurate ICD coding is fundamental to proper health insurance claim processing, reimbursement, and statistical analysis. Misrepresenting diagnoses can lead to claim denials, audits, financial penalties, and inaccurate public health data. Health insurance professional HIP must possess a thorough understanding of ICD coding principles and their application to ensure compliance with regulatory requirements and ethical standards. The correct approach involves meticulously reviewing the patient's medical record to identify all documented diagnoses, and then selecting the most specific and accurate ICD code that reflects the physician's documented condition. This adheres to the principle of coding to the highest level of specificity, which is a core tenet of ICD coding guidelines, and is implicitly required by payers to ensure appropriate reimbursement and to track healthcare utilization accurately. This approach ensures that the claim accurately reflects the services provided and the patient's condition, thereby complying with payer policies and federal regulations, such as those enforced by CMS in the U.S., if applicable to the HIP exam's jurisdiction. An incorrect approach of using a less specific code fails to capture the full clinical picture and may not justify the services rendered, potentially leading to underpayment or claim rejection. It violates the principle of coding to the highest level of specificity. Another incorrect approach of coding based on assumptions or patient self-reporting, without physician documentation, is a significant ethical and regulatory failure. ICD codes must be based on physician-documented diagnoses. Coding without physician documentation is considered fraudulent and can lead to severe penalties. It bypasses the established medical record review process and introduces unverified information into the billing system. A further incorrect approach of selecting a code that is not supported by the physician's documentation, even if it seems plausible, is also a violation. This can occur if the coder is trying to help the claim by selecting a code they believe the physician should have documented. This is a form of upcoding or misrepresentation, which is unethical and illegal. The coder's role is to accurately reflect the physician's documentation, not to interpret or alter it. The professional decision-making process for similar situations should involve a systematic review of the medical record, cross-referencing physician documentation with ICD coding guidelines, and consulting with the physician if any ambiguity exists. When in doubt, seeking clarification from the physician or a coding supervisor is paramount to ensure accuracy and compliance. The HIP must prioritize accuracy, specificity, and adherence to documented medical evidence above all else. Question 4. The performance metrics show a consistent increase in client inquiries regarding coverage for experimental treatments. A specific client has contacted you, expressing a strong desire for coverage of a new, unproven therapy for a chronic condition, stating that their physician believes it is their only hope. The policy document contains a clause stating that coverage is limited to treatments that are medically necessary and proven effective for the condition. What is the most appropriate course of action for the health insurance professional HIP in this situation? Option A. Suggest the client explore alternative, non-experimental treatments that are clearly covered under their policy without delving into the specifics of the experimental therapy's coverage. Option B. Advise the client that coverage for experimental treatments is typically excluded unless specific pre-authorization criteria are met, and initiate a formal review process by gathering all relevant medical documentation and policy details to determine eligibility based on the medically necessary and proven effective clause. Option C. Inform the client that since their physician recommends the treatment, it is likely covered, and proceed with submitting a claim for reimbursement. Option D. Explain to the client that while the treatment is experimental, You will advocate for its coverage by the insurer based on their physician's recommendation and the client's expressed hope. The correct answer is B. Advise the client that coverage for experimental treatments is typically excluded unless specific pre-authorization criteria are met, and initiate a formal review process by gathering all relevant medical documentation and policy details to determine eligibility based on the medically necessary and proven effective clause. Explanation. This scenario presents a professional challenge because it requires a health insurance professional, HIP, to balance client needs with regulatory compliance and ethical obligations. The HIP must interpret and apply complex policy terms and conditions accurately, ensuring that the client receives the benefits they are entitled to while adhering to the insurer's guidelines and relevant legislation. Misinterpreting policy provisions or failing to communicate them clearly can lead to client dissatisfaction, potential disputes, and regulatory scrutiny. The correct approach involves a thorough review of the specific policy wording, relevant medical documentation, and applicable health insurance regulations. This approach is right because it prioritizes accuracy and adherence to the contractual agreement between the insurer and the insured, as well as the legal framework governing health insurance. By meticulously examining the policy's coverage limitations, exclusions, and definitions, the HIP can provide a definitive and compliant answer to the client's query. This aligns with the ethical duty of competence and diligence expected of a HIP, ensuring that advice is informed and legally sound. An incorrect approach that focuses solely on the client's expressed desire for coverage without verifying it against the policy terms and regulations is professionally unacceptable. This failure stems from a lack of due diligence and a disregard for the contractual obligations and regulatory requirements. It could lead to the client being led to believe they have coverage that does not exist, resulting in financial hardship and a breach of trust. Another incorrect approach that involves making assumptions about coverage based on similar past cases, without consulting the specific policy for the current client, is also professionally flawed. This demonstrates a lack of attention to detail and a failure to uphold the principle of individual policy assessment. Each policy has unique terms, and relying on past experiences without verification is a significant regulatory and ethical lapse. Finally, an approach that delays providing a clear answer to the client, hoping the situation resolves itself or that the client will abandon the request, is unethical and unprofessional. This demonstrates a lack of commitment to client service and a failure to act with integrity. HIPs have a responsibility to address client inquiries promptly and transparently, providing accurate information within a reasonable time frame. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the client's query thoroughly. 2. Identify the relevant policy provisions and any associated documentation. 3. Consult applicable health insurance laws, regulations, and guidelines. 4. Analyze the information gathered, comparing the client's situation against the policy terms and regulatory requirements. 5. Formulate a clear, accurate, and compliant response. 6. Communicate the response to the client in an understandable manner, explaining the rationale. 7. Document the process and the advice provided. Question 5. The monitoring system demonstrates that a member enrolled in a point of service (POS) plan has inquired about seeking treatment from a specialist who is not in their health insurance network. The member states they want to ensure they are fully covered for this out-of-network care. As a health insurance professional HIP, what is the most accurate and ethically responsible approach to advising this member? Option A. Advise the member that they must only seek care from in-network providers to ensure full coverage and that any out-of-network care will not be covered at all. Option B. Explain that under their POS plan, they have the flexibility to see any provider they choose, and their coverage will be the same as if they saw an in-network provider, regardless of the specialist's network status. Option C. Inform the member that while their POS plan allows for out-of-network care, they should expect higher deductibles, coinsurance, and out-of-pocket maximums compared to in-network services, and they may be responsible for the difference between the provider's charges and the plan's allowed amount. Option D. Tell the member that the plan does not cover out-of-network services and that they will be entirely responsible for the full cost of any care received from a non-network provider. The correct answer is B. Explain that under their POS plan, they have the flexibility to see any provider they choose and their coverage will be the same as if they saw an in-network provider, regardless of the specialist's network status. Explanation: this scenario is professionally challenging because it requires a health insurance professional (HIP) to navigate the complexities of a point-of-service POS plan, specifically concerning out-of-network care and member financial responsibility, while adhering strictly to the regulatory framework governing health insurance in the United States. The HIP must ensure accurate communication of plan benefits and limitations to prevent member dissatisfaction and potential regulatory noncompliance. Careful judgment is required to interpret the plan documents and communicate them clearly and ethically to the member. The correct approach involves accurately informing the member about the financial implications of seeking care from an out-of-network provider under their POS plan. This includes explaining that while the POS plan allows for out-of-network care, it will be subject to higher deductibles, coinsurance, and out-of-pocket maximums compared to in-network care. Furthermore, the HIP must emphasize that the member will likely be responsible for the difference between the provider's billed amount and the plan's allowed amount for out-of-network services, a concept often referred to as balance billing, which is a key characteristic of POS plans when utilizing out-of-network benefits. This approach aligns with the Health Insurance Portability and Accountability Act, HIPAA, privacy rules by ensuring accurate and transparent communication of benefits, and with state insurance regulations that mandate clear disclosure of plan terms and conditions to policyholders. Ethical practice dictates that members should not be misled about their coverage. An incorrect approach would be to simply state that the member can see any doctor they choose without further qualification. This fails to acknowledge the financial differences inherent in out-of-network utilization under a POS plan, and could lead the member to believe their cost-sharing will be the same as for in-network care, which is a misrepresentation of benefits. This violates the principle of accurate disclosure and could lead to unexpected financial burdens for the member, potentially resulting in grievances and regulatory scrutiny. Another incorrect approach would be to advise the member that they will be fully covered for any out-of-network services, regardless of the provider's charges. This is a direct misstatement of benefits and ignores the concept of the plan's usual and customary or reasonable and customary charges for out-of-network services, as well as the higher cost-sharing provisions. Such advice is not only factually incorrect, but also ethically unsound, as it creates a false sense of security regarding coverage. A third incorrect approach would be to refuse to provide any information about out-of-network benefits, citing that the plan is a POS plan and the member should figure it out themselves. While a HIP should not provide medical advice, they are responsible for explaining the financial aspects of plan benefits. Withholding information about how out-of-network care is covered under a POS plan is a failure to provide essential benefit information and can be seen as a dereliction of duty, potentially violating consumer protection regulations that require clear and accessible information about health insurance coverage. The professional decision-making process for similar situations should involve 1. Thoroughly reviewing the specific plan documents for the POS plan in question, paying close attention to the sections detailing out-of-network benefits, cost-sharing, and any limitations. 2. Communicating the information clearly and concisely to the member, using plain language to explain concepts like deductibles, coinsurance, out-of-pocket maximums, and the potential for balance billing for out-of-network services. 3. Emphasizing that while out-of-network care is permitted, it will likely result in higher out-of-pocket expenses for the member compared to in-network care. 4. Advising the member to contact the provider's office to understand their estimated financial responsibility for out-of-network services, and to confirm if the provider accepts the plan's allowed amount as payment in full for in-network benefits, or if they anticipate balance billing. 5. Documenting the conversation and the information provided to the member. Question 6. Operational review demonstrates a need to clarify the fundamental definition of health insurance for client advisory purposes. Which of the following best aligns with the regulatory framework for health insurance professionals regarding what constitutes health insurance? Option A. Any arrangement where a provider directly bills a patient for medical services rendered. Option B. A service that offers discounts on medical procedures without involving a formal risk-sharing agreement. Option C. A direct payment from an employer to an employee to cover out-of-pocket medical expenses. Option D. A contract where an insurer agrees to pay for specified medical services and treatments for the insured based on the pooling of risk among a group of individuals. The correct answer is D. A contract where an insurer agrees to pay for specified medical services and treatments for the insured, based on the pooling of risk among a group of individuals. Explanation. This scenario presents a professional challenge because it requires a precise understanding of the definition of health insurance within the specific regulatory framework governing the health insurance professional HIP exam. Misinterpreting this definition can lead to incorrect advice, non-compliance, and potential harm to consumers. Careful judgment is required to distinguish between services that constitute health insurance and those that do not, based on established legal and regulatory definitions. The correct approach involves identifying the core components that define health insurance under the relevant regulations. This typically includes coverage for medical expenses, a risk-sharing mechanism, and a contract between an insurer and an insured. By adhering to this definition, professionals ensure they are accurately classifying products and services, providing compliant advice, and upholding consumer protection standards. The regulatory justification lies in the explicit definitions provided by the governing bodies, which are designed to ensure clarity, prevent misrepresentation, and maintain the integrity of the health insurance market. An incorrect approach that focuses solely on the provision of medical services without considering the insurance contract and risk-sharing element fails to meet the regulatory definition. This is a failure because it overlooks the fundamental nature of insurance as a financial product designed to mitigate risk, not merely a service provider. Another incorrect approach that emphasizes the payment of any medical bill without a formal insurance contract or risk-pooling mechanism is also flawed. This ignores the structured nature of insurance and the regulatory oversight required for such financial arrangements. A third incorrect approach that defines health insurance as any arrangement where a third party pays for medical care, regardless of whether it's a regulated insurance product, is problematic as it broadens the definition beyond established legal parameters and could encompass non-insurance arrangements that are not subject to the same consumer protections. Professionals should approach such situations by first consulting the specific definitions provided in the Health Insurance Professional HIP exam's regulatory framework. They must then analyze the characteristics of the product or service in question against these definitions, paying close attention to elements such as the presence of a contract, the pooling of risk, and the coverage of medical expenses. When in doubt, seeking clarification from regulatory bodies or legal counsel is a prudent step to ensure compliance and ethical practice. Question 7. Compliance review shows that a health insurance professional, HIP, is explaining the differences between two common individual health insurance plan types to a prospective client. The HIP describes one plan as having a significantly higher deductible than typical plans, which is often paired with a tax-advantaged savings account for medical expenses, and the other plan as offering flexibility to see providers both in and out of network, with varying cost-sharing for each. Which of the following descriptions most accurately aligns with the regulatory framework for these plan types? Option A. The plan with the higher deductible and potential for a tax-advantaged savings account is a high-deductible health plan, HDHP, and the plan offering in and out-of-network flexibility is a preferred provider organization, PPO plan. Option B. The plan with the higher deductible and potential for a tax-advantaged savings account is a high-deductible health plan, HDHP, and the plan offering in and out-of-network flexibility is a health maintenance organization, HMO plan. Option C. The plan with the higher deductible and potential for a tax-advantaged savings account is a health maintenance organization, HMO plan, and the plan offering in and out-of-network flexibility is a high-deductible health plan, HDHP. Option D. The plan with the higher deductible and potential for a tax-advantaged savings account is a preferred provider organization, PPO plan, and the plan offering in and out-of-network flexibility is a high-deductible health plan, HDHP. The correct answer is A. The plan with the higher deductible and potential for a tax-advantaged savings account is a high-deductible health plan, HDHP, and the plan offering in and out-of-network flexibility is a preferred provider organization, PPO plan. Explanation. This scenario presents a professional challenge because it requires a health insurance professional HIP to accurately differentiate between two common types of individual health insurance plans, specifically a high-deductible health plan, HDHP, and a preferred provider organization, PPO plan, based on their core characteristics and regulatory implications. The challenge lies in ensuring the client fully understands the distinct cost-sharing mechanisms, network restrictions, and potential tax advantages associated with each, thereby enabling an informed enrollment decision. Mischaracterizing these plans can lead to significant client dissatisfaction, financial hardship, and potential regulatory noncompliance for the HIP. The correct approach involves clearly explaining that a high-deductible health plan, HDHP, is characterized by a higher deductible than traditional plans and is often paired with a health savings account, HSA, which offers tax-advantaged savings for qualified medical expenses. This approach is correct because it accurately reflects the defining features of an HDHP as mandated by regulations governing health insurance products, particularly concerning eligibility for HSA contributions. It also emphasizes the cost-sharing structure and the potential for tax benefits, which are crucial considerations for consumers selecting this type of plan. An incorrect approach would be to describe a high-deductible health plan, HDHP, as a plan that offers lower out-of-pocket maximums than a preferred provider organization, PPO plan. This is incorrect because HDHP, by definition, have higher deductibles, and while out-of-pocket maximums are regulated, the primary distinguishing feature of an HDHP is its high deductible, not a lower out-of-pocket maximum compared to a PPO. This misrepresentation could mislead a client into believing they will have less financial exposure for immediate medical costs than is actually the case. Another incorrect approach would be to state that a preferred provider organization, PPO, plan requires all care to be received from in-network providers to receive any coverage. This is incorrect because PPO plans typically offer flexibility, allowing members to seek care from out-of-network providers, albeit at a higher cost-sharing level. Mandating in-network-only care is characteristic of other plan types, such as health maintenance organizations, HMO, not PPOs. This misstatement would inaccurately portray the network flexibility of a PPO. A further incorrect approach would be to suggest that a high-deductible health plan, HDHP, does not permit the use of health savings accounts, HSA, and instead requires all medical expenses to be paid directly by the enrollee until the deductible is met. This is incorrect because a key feature, and often a regulatory requirement for an HDHP to be considered HSA eligible, is that it must be paired with an HSA, and the plan itself must meet specific deductible and out-of-pocket limits. The statement misrepresents the fundamental relationship between HDHP and HSAs. The professional decision-making process for similar situations should involve a thorough understanding of the specific plan designs and their regulatory definitions. HIPs must prioritize accurate and transparent communication, ensuring that clients comprehend the financial implications, network structures, and any associated tax advantages or limitations of each plan option. This requires consulting official plan documents and regulatory guidance to provide advice that is both compliant and in the best interest of the client. Question 8. Consider a scenario where a Medicare beneficiary expresses confusion about their current Medicare Advantage plan, stating they are unsure if it covers their prescription medications and if they should switch back to original Medicare. As a health insurance professional HIP, what is the most appropriate initial step to address this beneficiary's concerns? Option A. Provide a list of the top-rated Medicare Advantage plans in their area and suggest they review these options to find a plan with better prescription drug coverage. Option B. Immediately recommend that the beneficiary disenroll from their Medicare Advantage plan and enroll in Original Medicare, as this is often a simpler option for medication coverage. Option C. Advise the beneficiary that all Medicare Advantage plans include prescription drug coverage and that they likely have adequate coverage for their medications. Option D. Explain the fundamental differences between Original Medicare Parts A and B and Medicare Advantage Part C plans, including how prescription drug coverage, Part D, is integrated into Part C plans, and inquire about their specific concerns regarding medication coverage and their current plan's benefits. The correct answer is D. Explain the fundamental differences between Original Medicare Parts A and B and Medicare Advantage Part C plans, including how prescription drug coverage, Part D, is integrated into Part C plans, and inquire about their specific concerns regarding medication coverage and their current plan's benefits. Explanation. This scenario presents a professional challenge because it requires a health insurance professional, HIP, to navigate the complexities of Medicare enrollment rules, specifically the interplay between original Medicare and Medicare Advantage plans, while ensuring the beneficiary's needs are met without misrepresentation or undue influence. The HIP must act as a trusted advisor, providing accurate information to enable an informed decision. The correct approach involves clearly explaining the fundamental differences between original Medicare, Parts A and B, and Medicare Advantage, Part C plans, including how prescription drug coverage, Part D, is integrated into Part C plans. This approach is correct because it directly addresses the beneficiary's stated confusion by providing a foundational understanding of their options. It adheres to regulatory requirements by ensuring transparency and accuracy in explaining plan benefits, limitations, and enrollment periods. The HIP's role is to educate, not to steer, and this approach empowers the beneficiary to make a choice aligned with their healthcare needs and preferences, respecting their autonomy. This aligns with ethical obligations to act in the best interest of the client and to provide unbiased advice. An incorrect approach would be to immediately recommend a specific Medicare Advantage plan without fully understanding the beneficiary's current coverage or healthcare needs. This is incorrect because it bypasses the crucial step of assessing the beneficiary's situation and could lead to a plan that is not suitable, potentially causing financial hardship or inadequate coverage. This fails to meet the regulatory requirement of providing accurate and comprehensive information tailored to the individual. It also violates ethical principles by potentially prioritizing a sale over the beneficiary's well-being. Another incorrect approach would be to simply state that Medicare Advantage plans include prescription drug coverage without elaborating on the specifics of Part D plans, such as formulary differences, co-pays, and coverage gaps. This is incorrect because it provides incomplete information. While technically true that Part C plans include Part D, the nuances of prescription drug coverage are critical for beneficiaries and can vary significantly between plans. Failing to explain these details can lead to misunderstandings and dissatisfaction later, violating the duty to provide clear and complete information. Finally, an incorrect approach would be to advise the beneficiary to disenroll from their current Medicare Advantage plan and enroll in original Medicare without a thorough assessment of why they are considering this change and the implications of such a move. This is incorrect because it assumes a solution without understanding the problem. Disenrolling from Medicare Advantage means losing benefits like dental, vision, and hearing coverage that may be included, and it requires separate enrollment in a Part D plan, which may have different costs and coverage than their current integrated plan. This approach fails to provide personalized guidance and could lead to a less advantageous coverage situation for the beneficiary, violating the HIP's duty of care and ethical responsibility. The professional decision-making process for similar situations should begin with active listening to understand the beneficiary's concerns and current situation. This should be followed by a comprehensive needs assessment, considering their health status, medication requirements, preferred providers, and budget. Then, the HIP should provide clear, unbiased education on all available Medicare options, explaining the benefits, drawbacks, costs, and enrollment rules for each. The ultimate decision rests with the beneficiary, and the HIP's role is to facilitate an informed choice. Question 9. The risk matrix shows a historical trend of increasing healthcare costs and a corresponding rise in the prevalence of chronic diseases, impacting the sustainability of health insurance products. Considering the evolution of health insurance from early forms focused on catastrophic illness to more comprehensive managed care models, and the current emphasis on preventative health, which stakeholder perspective best informs a HIP strategy for addressing these challenges? Option A. The perspective of a public health advocate emphasizing the long-term societal benefits of preventative care and chronic disease management programs. Option B. The perspective of a provider focused solely on maximizing reimbursement rates for all services rendered. Option C. The perspective of an insurer prioritizing short-term profit margins by limiting coverage for chronic conditions. Option D. The perspective of a patient advocating for immediate access to all available treatments regardless of cost or long-term efficacy. The correct answer is B. The perspective of a provider focused solely on maximizing reimbursement rates for all services rendered. Explanation. The risk matrix shows a historical trend of increasing healthcare costs and a corresponding rise in the prevalence of chronic diseases, impacting the sustainability of health insurance products. This scenario is professionally challenging because it requires a health insurance professional to understand the historical context of health insurance development to anticipate future challenges and advise stakeholders effectively. A HIP must balance the need for financial solvency with the ethical imperative to provide accessible and affordable coverage. The correct approach involves recognizing that the evolution of health insurance has been driven by a continuous effort to manage risk and adapt to changing demographics and medical advancements. This includes understanding the shift from indemnity-based plans to managed care, the impact of government regulations, such as the ACA in the U.S. context, assuming this is the relevant jurisdiction for the HIP exam, and the increasing focus on preventative care and wellness programs. A HIP should leverage this historical understanding to advocate for proactive strategies that address rising costs and chronic disease management, such as promoting wellness initiatives, negotiating better provider contracts, and exploring innovative plan designs that incentivize healthy behaviors. This aligns with the ethical duty to act in the best interest of both the insured and the insurer by fostering a sustainable and effective health insurance system. An incorrect approach would be to solely focus on short-term cost containment measures without considering the long-term implications for access to care or the historical lessons learned from previous insurance models. For instance, simply increasing deductibles and copays without a comprehensive strategy might lead to adverse selection and reduced coverage for those most in need, a problem that earlier forms of health insurance struggled with. Another incorrect approach would be to ignore the impact of chronic diseases, which have become a major driver of healthcare expenditure, and continue to offer plans that do not adequately address their management. This would fail to acknowledge the significant evolution in understanding and treating chronic conditions that has shaped modern health insurance. Furthermore, a HIP who fails to consider the regulatory landscape, such as the requirements for essential health benefits or consumer protections, will be acting unethically and illegally, potentially jeopardizing the solvency of the plan and the well-being of its members. The professional decision-making process for similar situations requires a deep understanding of the historical trajectory of health insurance, its successes and failures, and the underlying socio-economic and medical factors that have influenced its development. HIPs should engage in continuous learning, analyze current trends in light of historical patterns, and collaborate with stakeholders to develop forward-thinking solutions that are both financially sound and ethically responsible. This involves a proactive, rather than reactive, stance, informed by a comprehensive grasp of the past to shape a better future for health insurance. Question 10. Stakeholder feedback indicates a desire to develop new health insurance products that offer more flexibility in benefit design and cost-sharing options to appeal to a broader market segment. As a health insurance professional operating under U.S. federal and state regulations, what is the most appropriate approach to developing these new products? Option A. Focus on replicating the most popular features of competitor products, assuming they are compliant, and implement them quickly to gain market share without extensive independent regulatory review. Option B. Conduct a thorough impact assessment that analyzes the proposed product designs against all applicable federal and state insurance laws, including requirements for essential health benefits, actuarial value, and consumer disclosures, while evaluating potential effects on affordability and access for various enrollee populations. Option C. Prioritize the development of products that offer the lowest possible premiums by minimizing benefit mandates and increasing enrollee cost-sharing, assuming that market demand will drive compliance. Option D. Introduce innovative cost-sharing mechanisms and benefit structures that are not explicitly prohibited by current regulations, with the intention of seeking regulatory approval after the products are launched and have demonstrated market viability. The correct answer is B. Conduct a thorough impact assessment that analyzes the proposed product designs against all applicable federal and state insurance laws, including requirements for essential health benefits, actuarial value, and consumer disclosures, while evaluating potential effects on affordability and access for various enrollee populations. Explanation: this scenario is professionally challenging because it requires a health insurance professional to balance competing stakeholder interests while adhering to the specific regulatory framework governing health insurance development in the United States. The challenge lies in understanding how proposed changes to insurance product design can impact affordability, access, and consumer protection, all of which are central tenets of U.S. health insurance law. Careful judgment is required to ensure that any development aligns with the spirit and letter of regulations like the Affordable Care Act, ACA, and state-specific insurance mandates, without creating unintended negative consequences for vulnerable populations or the overall market stability. The correct approach involves a comprehensive impact assessment that prioritizes regulatory compliance and consumer welfare. This means thoroughly analyzing how proposed changes to health insurance products, such as introducing tiered benefit designs or new cost-sharing mechanisms, would affect premium rates, out-of-pocket expenses for enrollees, and the availability of essential health benefits. It necessitates consulting relevant federal and state insurance regulations to ensure all proposed features meet minimum standards for coverage and consumer protection. Furthermore, it requires evaluating the potential impact on different demographic groups to ensure equitable access and affordability, aligning with the goals of promoting a stable and accessible health insurance market. This approach is ethically sound and regulatorily compliant as it proactively identifies and mitigates risks, ensuring that product development serves the public interest and adheres to legal obligations. An incorrect approach would be to prioritize market competitiveness or potential profit margins over regulatory adherence and consumer impact. For instance, developing products that subtly shift costs to consumers through complex deductibles or co-insurance structures without clear disclosure, or that inadvertently exclude coverage for essential services mandated by law, would represent a significant regulatory failure. Such an approach would violate consumer protection laws and potentially the ACA's requirements for essential health benefits and actuarial value. Another incorrect approach would be to implement changes based solely on competitor offerings without conducting an independent assessment of their legality and consumer impact within the specific U.S. regulatory landscape. This could lead to offering non-compliant products, facing regulatory sanctions, and damaging consumer trust. Professionals should employ a decision-making framework that begins with a thorough understanding of the applicable U.S. federal and state health insurance laws and regulations. This framework should include a robust risk assessment process that evaluates potential impacts on affordability, access, and consumer protection. Engaging with legal counsel and regulatory experts early in the development process is crucial. Furthermore, a commitment to transparency and clear communication with stakeholders, including consumers and regulators, is paramount. When faced with competing priorities, the framework should mandate that regulatory compliance and consumer welfare always take precedence, as failure to do so can result in severe legal and ethical repercussions. Question 11. Stakeholder feedback indicates that some clients express confusion when reviewing their health insurance policy's declarations page, often asking for clarification on specific terms or their implications for coverage. As a health insurance professional HIP, what is the most appropriate way to address this feedback and assist clients in understanding this critical document? Option A. Offer to walk through the declarations page with the client, explaining the purpose of each section and common terminology used, while advising them to consult the full policy document or the insurer for definitive interpretations of coverage. Option B. Advise the client to simply read the declarations page thoroughly and contact the insurance company directly if they have any questions, as the HIP is not authorized to interpret policy details. Option C. Suggest the client seek legal counsel to understand the declarations page, as it is a legally binding document and the HIP cannot provide such guidance. Option D. Provide a detailed interpretation of specific clauses on the declarations page, explaining precisely what will and will not be covered based on the client's individual circumstances. The correct answer is A. Offer to walk through the declarations page with the client, explaining the purpose of each section and common terminology used, while advising them to consult the full policy document or the insurer for definitive interpretations of coverage. Explanation. This scenario presents a professional challenge because it requires the health insurance professional HIP to navigate a situation where a client's understanding of their policy, specifically the declarations page, is incomplete, potentially leading to misunderstandings about coverage and out-of-pocket expenses. The HIP must balance providing accurate information with respecting the client's autonomy and avoiding the unauthorized practice of law or providing financial advice. The declarations page is a critical document that summarizes key policy details, and ensuring the client comprehends it is fundamental to good client service and regulatory compliance. The correct approach involves proactively offering to review the declarations page with the client, explaining its purpose and key components in clear, understandable language, without offering definitive interpretations of legal or financial implications. This approach is correct because it directly addresses the client's stated need for clarity regarding their policy specifics, aligns with the HIP's role in facilitating client understanding of insurance products, and adheres to ethical guidelines that promote transparency and informed decision-making. By offering to explain the purpose and components of the declarations page, the HIP is providing educational support within their professional scope, empowering the client to better understand their coverage. This respects the client's right to understand their policy and avoids misinterpretations that could lead to future disputes or dissatisfaction. An incorrect approach would be to simply tell the client to read the declarations page carefully without further assistance. This fails to adequately address the client's expressed confusion and can be perceived as dismissive, potentially violating ethical obligations to provide reasonable assistance and ensure client comprehension. It also misses an opportunity to reinforce the value of the HIP's expertise in navigating complex insurance documents. Another incorrect approach would be to interpret specific clauses or provide definitive statements about what the policy will or will not cover based on the declarations page. This crosses the line into providing legal or financial advice, which is outside the scope of a HIP's license and expertise. Doing so could lead to liability if the interpretation proves incorrect and the client suffers financial loss. It also bypasses the established channels for policy interpretation, such as referring the client to the insurer's claims department or a legal professional if complex legal questions arise. A third incorrect approach would be to ignore the client's request and proceed with other administrative tasks. This demonstrates a lack of client focus and a failure to address a potential misunderstanding that could have significant consequences for the client's health and financial well-being. It also undermines the trust relationship between the HIP and the client and could lead to regulatory complaints. The professional decision-making process in such situations should involve 1. Actively listening to the client's concerns to understand the root of their confusion. 2. Identifying the HIP's scope of practice and ethical boundaries. 3. Offering assistance that falls within those boundaries, such as explaining the function and typical contents of policy documents. 4. Clearly stating what the HIP can and cannot do, such as explaining the purpose of a section versus interpreting its legal meaning. 5. Documenting the interaction and the advice provided. 6. Knowing when to refer the client to other professionals, e.g., the insurer, a legal advisor, for matters outside the HIP's purview. Question 12. Compliance review shows that a family is applying for CHIP coverage for their child. The parent states their household income is below the threshold but cannot immediately provide recent pay stubs, only a general estimate. They also mention a recent change in living arrangements with a relative, but are unsure of the exact documentation required to prove residency for all household members. What is the most appropriate risk assessment approach for the HIP to take? Option A. Advise the applicant that their situation is too complex and suggest they seek assistance from a different agency. Option B. Deny coverage immediately due to the lack of immediate verifiable documentation for income and residency. Option C. Approve coverage based on the parent's verbal assurance of income and the stated change in living arrangements, assuming the information will be substantiated later. Option D. Request specific documentation to verify income and residency according to CHIP guidelines, informing the applicant of the required documents and providing a reasonable timeframe for submission. The correct answer is D. Request specific documentation to verify income and residency according to CHIP guidelines, informing the applicant of the required documents and providing a reasonable timeframe for submission. Explanation. This scenario presents a professional challenge because it requires a health insurance professional (HIP) to navigate the complexities of eligibility determination for the Children's Health Insurance Program (CHIP), while balancing the need for accurate information with the sensitivity of family circumstances. The HIP must apply the specific federal and state guidelines for CHIP eligibility, which often involve income thresholds, household composition, and residency requirements, without overstepping professional boundaries or making assumptions. The challenge lies in gathering sufficient, verifiable information to make a correct determination while respecting the applicant's privacy and potential financial hardship. The correct approach involves a systematic and thorough review of all provided documentation against the established CHIP eligibility criteria. This includes verifying income through pay stubs, tax returns, or other approved methods, confirming household composition with birth certificates or other legal documents, and ensuring residency is established according to program rules. This approach is correct because it directly adheres to the regulatory framework governing CHIP, ensuring that only eligible children receive coverage, thereby maintaining program integrity and responsible use of public funds. It also upholds ethical obligations to provide accurate information and assistance to applicants. An incorrect approach would be to make an eligibility determination based solely on the applicant's verbal assertion of income or household size, without requesting or reviewing supporting documentation. This is a regulatory failure because CHIP programs mandate verification of key eligibility factors to prevent fraud and ensure equitable distribution of benefits. Ethically, it is a failure to exercise due diligence and could lead to either ineligible children receiving benefits or eligible children being denied coverage due to insufficient proof. Another incorrect approach would be to deny coverage immediately based on a single piece of incomplete or potentially inaccurate information, without offering the applicant an opportunity to provide additional documentation or clarification. This is a regulatory failure as it bypasses established procedures for appeals or requests for additional information, which are often part of the application process. Ethically, it demonstrates a lack of compassion and a failure to assist individuals in navigating the system, potentially causing undue hardship. A third incorrect approach would be to provide a definitive eligibility determination based on assumptions about the applicant's circumstances or by comparing them to other applicants. This is a significant regulatory and ethical failure. Regulatory failure occurs because CHIP eligibility is determined on an individual basis according to specific criteria, not by comparison or assumption. Ethical failure arises from bias, lack of objectivity, and a potential violation of privacy if information from other applicants is used inappropriately. The professional decision-making process for similar situations should involve a commitment to understanding and applying the specific regulations governing the program in question. HIPs should adopt a methodical approach to information gathering, clearly communicate required documentation to applicants, and provide reasonable opportunities for applicants to meet those requirements. When faced with ambiguity, seeking clarification from supervisors or program guidelines is essential. The overarching principle is to ensure fairness, accuracy, and compliance with all applicable laws and ethical standards. Question 13. Quality control measures reveal a pattern where health insurance professionals, HIP, are frequently requesting extensive, detailed clinical notes from mental health and substance abuse providers for routine outpatient therapy authorizations, often exceeding what is strictly necessary to determine medical necessity. Which of the following approaches represents the most appropriate and compliant best practice for HIPs when authorizing these services? Option A. Requesting specific clinical information from the provider that directly supports the medical necessity of the requested treatment, such as diagnosis, treatment goals, and expected duration, while adhering to HIPAA minimum necessary standard and relevant mental health parity laws. Option B. Denying authorization for all outpatient therapy services unless the provider submits a comprehensive psychiatric evaluation report, regardless of the service requested or the information already available. Option C. Requesting the provider to submit all available patient records, including past treatment history and non-clinical personal details, to ensure a thorough review for authorization. Option D. Directly contacting the patient to obtain detailed personal history and symptom descriptions to justify the authorization, bypassing the treating provider. The correct answer is A. Requesting specific clinical information from the provider that directly supports the medical necessity of the requested treatment, such as diagnosis, treatment goals, and expected duration, while adhering to HIPAA minimum necessary standard and relevant mental health parity laws. Explanation. This scenario presents a professional challenge because it requires balancing the insurer's need for accurate claims processing with the patient's right to privacy and access to necessary mental health and substance abuse services. The health insurance professional, HIP, must navigate complex regulations designed to protect sensitive health information, while ensuring that covered services are appropriately authorized and reimbursed. The core tension lies in obtaining sufficient clinical information for authorization without overstepping privacy boundaries or creating undue burdens on providers and patients. The correct approach involves a collaborative process between the HIP, the treating provider, and the patient, adhering strictly to the Health Insurance Portability and Accountability Act, HIPAA, and relevant state mental health parity laws. This approach prioritizes obtaining the minimum necessary information from the provider to justify the requested service, ensuring that the authorization decision is based on clinical necessity and adherence to policy guidelines. It also involves clear communication with the patient regarding the process and their rights. This aligns with best practices by respecting patient confidentiality, promoting timely access to care, and ensuring compliance with regulatory requirements for medical necessity reviews. An incorrect approach that involves requesting extensive, detailed clinical notes beyond what is required for authorization is a violation of HIPAA minimum necessary standard. This overreach can lead to unauthorized disclosure of protected health information, FI, and erode patient trust. Another incorrect approach, which is to deny authorization solely based on a lack of detailed diagnostic information without attempting to obtain the necessary clinical justification from the provider, fails to meet mental health parity obligations and may violate regulations requiring coverage for medically necessary services. Finally, an approach that bypasses the provider and directly requests sensitive diagnostic information from the patient without a clear, legally permissible reason, e.g., a specific patient consent for direct disclosure beyond standard authorization processes, also infringes upon privacy rights and regulatory mandates. Professional decision-making in such situations requires a systematic approach. First, understanding the specific policy benefits and limitations for mental health and substance abuse services. Second, identifying the precise regulatory requirements for authorization, particularly HIPAA minimum necessary standard and any state-specific mental health parity laws. Third, engaging in clear, professional communication with the treating provider to request only the information essential for the authorization decision. And fourth, documenting all interactions and decisions meticulously. This framework ensures that decisions are compliant, ethical, and patient-centered. Question 14. The efficiency study reveals that a significant portion of client inquiries regarding plan selection stem from a misunderstanding of how provider networks and referral requirements impact out-of-pocket expenses. A client expresses a strong preference for lower monthly premiums and is amenable to coordinating their care through a designated primary physician. Which type of health insurance plan best aligns with these stated preferences and the operational characteristics highlighted by the study? Option A, a high-deductible health plan, HDHP. Option B, a health maintenance organization, HMO plan. Option C, a point-of-service POS plan. Option D, a preferred provider organization, PPO plan. The correct answer is B, a health maintenance organization, HMO plan. Explanation: this scenario is professionally challenging because it requires a health insurance professional, HIP, to accurately identify the most suitable health insurance plan type for a client based on their specific needs and the plan's inherent characteristics, while adhering strictly to regulatory guidelines. Misinterpreting plan types can lead to client dissatisfaction, financial detriment, and potential regulatory noncompliance. Careful judgment is required to match client circumstances with the operational framework of each plan type. The correct approach involves recognizing that a health maintenance organization, HMO, plan is characterized by a network of providers, requiring referrals for specialist care, and typically offering lower out-of-pocket costs for in-network services. This aligns with a client who prioritizes cost containment and is willing to manage their care through a primary care physician. This approach is ethically sound and compliant with regulations that mandate accurate representation of plan benefits and limitations to consumers. An incorrect approach would be to recommend a preferred provider organization, PPO, plan without fully assessing the client's preference for provider choice and referral requirements. While PPOs offer more flexibility in choosing providers, they generally have higher premiums and out-of-pocket costs compared to HMOs. Recommending this, without considering the client's cost sensitivity and willingness to navigate referral systems, would be a failure to act in the client's best interest. Another incorrect approach is to suggest a point of service POS plan as a universal solution without explaining its hybrid nature, which combines features of both HMOs and PPOs and the associated complexities. This could lead to confusion and unexpected costs for the client. Finally, recommending a high-deductible health plan, HDHP, solely based on its lower premium, without thoroughly explaining the implications of a high deductible and the necessity of a health savings account, HSA, for tax advantages, would be a significant ethical and regulatory lapse. It fails to ensure the client understands the financial responsibility they are undertaking. Professionals should employ a client-centric decision-making process. This involves actively listening to the client's stated needs, financial situation, and preferences regarding healthcare access and cost. Subsequently, the HIP must possess a thorough understanding of the distinct features, benefits, and limitations of each health insurance plan type, HMO, PPO, POS, HDHP, etc., as defined by relevant U.S. federal and state regulations. The HIP should then clearly articulate these differences, using plain language, to enable the client to make an informed decision. This process ensures transparency, client autonomy, and regulatory adherence. Question 15. Strategic planning requires a health insurance professional HIP to evaluate potential changes to a health plan's prescription drug formulary. Which approach best balances the need for cost containment with ensuring adequate member access to necessary medications, while adhering to regulatory requirements? Option A. Making formulary decisions based on the most recent marketing materials provided by pharmaceutical manufacturers, without independent clinical review or consideration of member impact. Option B. Conducting a thorough review of proposed formulary changes, considering clinical effectiveness, member impact, cost-effectiveness, and ensuring a transparent and accessible appeals process for denied medications, all within the bounds of applicable federal and state insurance regulations. Option C. Implementing formulary changes that prioritize the lowest-cost generic alternatives for all therapeutic classes, with a limited exception process for brand-name drugs that is difficult for members to navigate. Option D. Focusing exclusively on reducing the overall drug spend by excluding all high-cost specialty medications from the formulary, regardless of their therapeutic necessity for specific member populations. The correct answer is C. Implementing formulary changes that prioritize the lowest-cost generic alternatives for all therapeutic classes, with a limited exception process for brand-name drugs that is difficult for members to navigate. Explanation: this scenario is professionally challenging because it requires a health insurance professional HIP to balance the financial sustainability of a health plan with the critical need to provide access to necessary prescription medications for its members. The HIP must navigate complex regulatory requirements, formulary management strategies, and potential ethical considerations regarding patient access to care. Careful judgment is required to ensure compliance with all applicable laws and guidelines, while upholding the fiduciary duty to plan sponsors and members. The correct approach involves a comprehensive assessment of the impact of proposed formulary changes on member access, cost, and overall plan value, while strictly adhering to the Health Insurance Portability and Accountability Act, HIPAA, for member privacy and any state-specific mandates regarding prescription drug coverage. This approach prioritizes member well-being and regulatory compliance by ensuring that any formulary adjustments are evidence-based, transparent, and do not create undue barriers to medically necessary treatments. It also considers the potential for member appeals and grievance processes, ensuring a fair and equitable system. An incorrect approach that focuses solely on cost reduction without adequately evaluating the clinical impact on members would be professionally unacceptable. This failure would violate the ethical obligation to act in the best interest of the insured, and could lead to non-compliance with regulations that mandate coverage for essential health benefits, including prescription drugs. Such an approach risks creating access gaps for members requiring specific medications, potentially leading to adverse health outcomes and increased long-term healthcare costs. Another incorrect approach that involves making formulary decisions based on anecdotal evidence or without a structured review process would also be professionally unsound. This lacks the rigor required for sound plan management and could result in the exclusion of clinically effective medications, thereby compromising member care and potentially violating regulatory standards for formulary design. A third, incorrect approach that fails to consider the appeals and grievance process for members who are denied coverage for a prescribed medication would be a significant ethical and regulatory failure. This oversight would deny members their right to challenge coverage decisions and could lead to non-compliance with consumer protection laws and regulations governing health insurance. The professional decision-making process for similar situations should involve a multifaceted evaluation. This includes understanding the specific regulatory landscape governing prescription drug coverage, conducting thorough clinical and economic reviews of proposed formulary changes, engaging with pharmacy benefit managers and clinical experts, and establishing clear, transparent processes for member communication, appeals, and grievances. The HIP must always prioritize member access to medically necessary prescription drugs within the framework of a financially sound health plan, ensuring all actions are compliant with relevant laws and ethical standards. Question 16. Governance review demonstrates that a client who has recently experienced a significant health event is seeking to understand their health insurance coverage options. The client expresses a strong preference for a plan with a lower monthly premium, believing this will be the most financially prudent choice moving forward. As a health insurance professional HIP, what is the most appropriate approach to guide this client? Option A. Recommend a plan based on what other clients with similar recent health events have chosen, as this reflects a proven track record of satisfaction. Option B. Conduct a thorough assessment of the client's current and anticipated future healthcare needs, considering their recent health event, family history, and financial capacity, and then present a range of suitable coverage options with clear explanations of their respective benefits, limitations, and cost-sharing structures. Option C. Advise the client to select the most comprehensive health insurance plan available, as this will ensure they are maximally protected against future medical expenses, regardless of the premium cost. Option D. Present only the health insurance plans that offer the lowest monthly premiums, as this directly addresses the client's stated preference for financial prudence. The correct answer is B. Conduct a thorough assessment of the client's current and anticipated future healthcare needs, considering their recent health event, family history, and financial capacity, and then present a range of suitable coverage options with clear explanations of their respective benefits, limitations, and cost-sharing structures. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the health insurance professional HIP to balance the client's immediate perceived need with the long-term implications of coverage choices, all within the strict confines of regulatory requirements. The HIP must act as a trusted advisor, ensuring the client understands the nuances of different benefit structures and their potential impact on future health and financial well-being, while also adhering to disclosure and suitability standards. Misinterpreting or misrepresenting coverage options can lead to significant client dissatisfaction, regulatory penalties, and damage to professional reputation. Correct approach analysis. The correct approach involves a thorough needs assessment that goes beyond the client's stated preference. This includes understanding their current health status, family history, anticipated future healthcare needs, and financial capacity. The HIP should then present a range of suitable coverage options, clearly explaining the benefits, limitations, deductibles, copays, and out-of-pocket maximums associated with each. Crucially, the HIP must ensure the client understands how these benefits translate into actual out-of-pocket costs for various medical services and how different plans might impact their access to preferred providers. This aligns with the regulatory framework's emphasis on client education, suitability, and acting in the client's best interest, ensuring informed decision-making. Incorrect approach is analysis. Presenting only the option that appears to offer the lowest premium without a comprehensive needs assessment is an incorrect approach. This fails to consider the client's actual healthcare utilization patterns and potential for high out-of-pocket expenses if a lower premium plan has less comprehensive benefits or higher cost sharing. This could violate suitability requirements and the duty to act in the client's best interest by prioritizing cost over adequate coverage. Recommending a plan solely based on a perceived trend or what other clients have chosen without individual assessment is also incorrect. Each client's situation is unique, and a one-size-fits-all recommendation disregards the specific health needs, risk tolerance, and financial circumstances that dictate the most appropriate coverage. This approach lacks the personalized advice mandated by professional standards and regulatory oversight, focusing exclusively on the most comprehensive and highest cost plan, assuming it is always the best option, is another incorrect approach. While comprehensive coverage is often beneficial, it may not be financially sustainable or necessary for every client. The HIP has a responsibility to recommend options that are both adequate and affordable, reflecting a balanced consideration of benefits and cost. This approach can lead to clients purchasing coverage they cannot afford or do not truly need, potentially causing financial strain. Professional reasoning. Professionals should adopt a client-centric decision-making process. This begins with active listening and a detailed needs analysis. The HIP must then leverage their expertise to translate complex policy details into understandable terms, highlighting the practical implications of different benefit structures. Transparency regarding all costs, limitations, and potential out-of-pocket expenses is paramount. The final recommendation should be a collaborative decision, ensuring the client feels empowered and confident in their choice, knowing it aligns with both their immediate needs and long-term financial and health security, all while strictly adhering to all applicable regulations. Question 17. System analysis indicates that a group health insurance plan participant has inquired about coverage for a pre-existing condition that developed prior to their enrollment in the employer's group health plan. The employer has expressed a strong desire to manage premium costs. What is the most appropriate initial approach for the health insurance professional HIP to take? Option A. Advise the participant that pre-existing conditions are typically excluded from coverage in group plans to control employer costs. Option B. Recommend that the participant explore individual health insurance options, as group coverage often has limitations for pre-existing conditions. Option C. Review the group health insurance policy's terms and conditions, specifically examining provisions related to pre-existing condition exclusions and waiting periods, and cross-reference with current federal regulations like the Affordable Care Act. Option D. Inform the employer that to control costs, the plan should enforce all historical pre-existing condition exclusion clauses. Correct answer is C. Review the group health insurance policy's terms and conditions, specifically examining provisions related to pre-existing condition exclusions and waiting periods, and cross-reference with current federal regulations like the Affordable Care Act. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a health insurance professional HIP to navigate the complex interplay between employer-sponsored group health insurance plan design and the specific needs of a diverse employee population, particularly concerning pre-existing conditions. The HIP must balance the employer's desire for cost containment with the ethical and regulatory obligation to ensure adequate coverage and non-discriminatory practices. Misinterpreting or misapplying regulations can lead to significant financial penalties, reputational damage, and harm to plan participants. Correct approach analysis. The correct approach involves a thorough review of the group health insurance policy's terms and conditions, specifically focusing on the provisions related to pre-existing condition exclusions and waiting periods. This approach is right because it directly addresses the core of the employee's concern by examining the contractual obligations and limitations of the plan. Under relevant U.S. federal regulations, such as the Health Insurance Portability and Accountability Act, HIPAA, group health plans are subject to rules regarding pre-existing condition exclusions, which have been significantly limited by the Affordable Care Act, ACA. The ACA generally prohibits group health plans from imposing pre-existing condition exclusions for all health plans. Therefore, a HIP must verify if the plan adheres to these federal mandates, ensuring that the employee's condition is covered according to current law, rather than relying on outdated policy language or assumptions. This aligns with the ethical duty to provide accurate information and uphold regulatory compliance. Incorrect approaches analysis. An approach that focuses solely on the employer's stated desire to control costs without first verifying regulatory compliance is incorrect. This fails to acknowledge the HIP's primary responsibility to ensure the plan operates within legal frameworks. Prioritizing cost containment over adherence to federal mandates like the ACA would be a significant regulatory failure, potentially exposing the employer an insurer to penalties for discriminatory or non-compliant coverage. An approach that assumes all pre-existing conditions are automatically excluded based on general industry knowledge or past practices is also incorrect. This overlooks the specific legal protections afforded to individuals under current U.S. health insurance law. Relying on outdated assumptions or generalized knowledge without consulting the specific plan documents and current regulations constitutes a failure to provide accurate advice and uphold regulatory standards. An approach that suggests the employee should seek individual coverage without first exhausting all avenues within the group plan is incorrect. This prematurely dismisses the potential for coverage under the group policy and fails to fulfill the HIP's role in assisting the employee with their current employer-sponsored benefit. It bypasses the obligation to investigate the group plan's compliance and potential coverage for the pre-existing condition, which could be a regulatory and ethical lapse. Professional reasoning. When faced with an employee inquiry about coverage for a pre-existing condition within a group health insurance plan, a HIP should follow a structured decision-making process. First, understand the employee's specific situation and concern. Second, immediately consult the group health insurance policy documents and relevant summary plan descriptions. Third, cross-reference these documents with current federal and state regulations governing group health insurance, paying particular attention to provisions on pre-existing conditions, waiting periods, and non-discrimination. Fourth, communicate clearly and accurately to the employee about their potential coverage based on the policy and applicable laws. If there are ambiguities or potential conflicts, escalate the issue to the plan administrator or legal counsel. The guiding principle is to ensure compliance with all applicable laws and ethical obligations to the plan participant. Question 18. The audit findings indicate a recurring issue where claims are submitted with the medical term dyspepsia without further specification regarding its cause or nature. This ambiguity has led to inconsistencies in claims processing and potential delays in benefit determination. As a health insurance professional what is the most appropriate course of action to address this situation and ensure compliance with regulatory standards for accurate medical documentation? Option A. Reject all claims containing the term dyspepsia until a more detailed diagnosis is provided by the provider. Option B. Assume dyspepsia refers to a common, uncomplicated form and process claims accordingly to expedite payment. Option C. Proceed with processing claims as submitted, relying on standard industry interpretations of dyspepsia to maintain workflow efficiency. Option D. Contact the healthcare provider to request clarification on the specific type or cause of dyspepsia documented for each affected claim. The correct answer is D. Contact the healthcare provider to request clarification on the specific type or cause of dyspepsia documented for each affected claim. Explanation. This scenario presents a professional challenge because it requires the health insurance professional to navigate a situation where a lack of precise medical terminology could lead to significant misunderstandings, impacting patient care and claims processing. The HIP must exercise careful judgment to ensure accurate communication and adherence to regulatory requirements. The correct approach involves clarifying the ambiguous medical term with the healthcare provider. This is the best professional practice because it directly addresses the root cause of the potential issue in precise language. By seeking clarification, the HIP ensures that the medical information recorded is accurate and reflects the provider's intent. This aligns with the ethical obligation to maintain professional competence and integrity, and it supports the regulatory requirement for accurate and complete documentation in health insurance claims. Clear and precise medical terminology is fundamental to correct coding, appropriate benefit determination, and preventing claim denials or overpayments, all of which are core responsibilities of a HIP. An incorrect approach would be to make an assumption about the meaning of the ambiguous term. This is professionally unacceptable because assumptions, especially in a medical context, can lead to significant errors. If the assumption is wrong, it could result in incorrect coding, leading to claim denials, improper payment, or even adverse patient outcomes if the incorrect information is used for treatment decisions. This violates the ethical duty of diligence and accuracy. Another incorrect approach would be to proceed with processing the claim without any clarification, hoping for the best. This is professionally unacceptable as it demonstrates a lack of due diligence and a disregard for the potential for error. It fails to uphold the HIP's responsibility to ensure the accuracy of information used in financial transactions and can lead to regulatory noncompliance if inaccurate data is submitted. A third incorrect approach would be to simply reject the claim due to the ambiguity without attempting to resolve it. While accuracy is important, an overly rigid approach that doesn't seek to resolve minor ambiguities can be detrimental to efficient claims processing and can negatively impact the provider-patient relationship. It fails to demonstrate a commitment to finding solutions and can be seen as unhelpful. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ambiguity or potential error. 2. Assess the potential impact of the ambiguity on claims processing, patient care, and regulatory compliance. 3. Determine the most appropriate course of action to resolve the ambiguity, prioritizing accuracy and ethical obligations. 4. If clarification is needed, contact the source of the information, e.g., healthcare provider, directly and professionally. 5. Document all actions taken and communications. 6. If resolution is not possible, follow established procedures for handling incomplete or ambiguous information, ensuring transparency and fairness. Question 19. Market research demonstrates that prospective clients often express interest in comprehensive health insurance coverage. As a health insurance professional HIP, you are meeting with a potential client who is eager to understand the benefits of a particular policy. While discussing the policy's features, you recognize that a thorough explanation of common exclusions is crucial for the client to make an informed decision. What is the most ethically sound and regulatorily compliant approach to addressing these exclusions? Option A. Explain the exclusions using highly technical insurance terminology to demonstrate your expertise and ensure the information is precisely conveyed. Option B. Briefly mention that there are exclusions but focus primarily on the policy's benefits to maintain the client's enthusiasm and expedite the sales process. Option C. Provide a detailed explanation of common policy exclusions, using clear language and providing practical examples to ensure the client fully understands what is not covered. Option D. Hand the client the policy document and state that all exclusions are detailed within, assuming they will read and understand them independently. The correct answer is C. Provide a detailed explanation of common policy exclusions, using clear language and providing practical examples to ensure the client fully understands what is not covered. Explanation. This scenario presents a professional challenge because it requires balancing the insurer's contractual obligations with the client's potential misunderstanding of policy terms, particularly concerning common exclusions. The health insurance professional HIP must navigate this situation ethically and in compliance with regulatory frameworks governing health insurance sales and client communication. The core of the challenge lies in ensuring transparency and preventing misrepresentation without alienating a potential client or creating a false sense of security. The correct approach involves proactively and clearly explaining the common exclusions to the prospective client, using plain language and providing examples. This aligns with regulatory requirements for fair dealing, disclosure, and preventing misleading conduct. Specifically, regulations often mandate that insurers and their representatives must ensure that clients understand the key terms and conditions of a policy, including what is not covered. By detailing common exclusions like pre-existing conditions, cosmetic surgery, or experimental treatments, the HIP fulfills their duty of care and upholds ethical standards of transparency. This proactive disclosure helps the client make an informed decision, reducing the likelihood of future disputes or dissatisfaction. An incorrect approach would be to downplay or omit the discussion of exclusions to secure the sale. This failure to disclose material information is a direct violation of regulatory principles that prohibit misleading or deceptive conduct. It creates a situation where the client may believe they are covered for services that are, in fact, excluded, leading to potential financial hardship and a breach of trust. Another incorrect approach is to provide overly technical or jargon-filled explanations of exclusions, which, while technically accurate, may not be understood by the client. This can be seen as a form of obfuscation, failing to meet the spirit of the disclosure requirements, and potentially leading to the same negative outcomes as outright omission. Finally, assuming the client has read and understood the policy document without further explanation is also an inadequate approach, as it neglects the professional responsibility to ensure comprehension. The professional decision-making process for similar situations should involve a commitment to transparency and client education. First, identify the core of the client's needs and concerns. Second, proactively anticipate areas of potential misunderstanding, such as common policy exclusions. Third, communicate these exclusions clearly, concisely, and in a manner that the client can readily understand, using relatable examples. Fourth, encourage questions and provide ample opportunity for clarification. Finally, document the discussion to ensure a record of the information provided. This systematic approach prioritizes informed consent and ethical practice, safeguarding both the client and the insurer. Question 20. The assessment process reveals that a new long-term care insurance product is being considered for market entry. The product offers several riders and benefit options. What is the most appropriate approach for the health insurance professional HIP to ensure the product's compliant and ethical offering to consumers in the United States? Option A. Conduct a thorough review of the specific state's insurance laws and regulations pertaining to long-term care insurance, including mandated benefits, disclosure requirements, and agent training standards, to ensure the product and sales process align with all applicable consumer protection laws. Option B. Focus primarily on the product's competitive premium structure and unique rider benefits to highlight its market differentiation and appeal to a broad consumer base. Option C. Utilize generic marketing materials and sales scripts that have been effective for other health insurance products, assuming they will be suitable for long-term care insurance. Option D. Prioritize a rapid sales cycle by providing only essential policy information and relying on the client's self-assessment of their long-term care needs. The correct answer is A. Conduct a thorough review of the specific state's insurance laws and regulations pertaining to long-term care insurance, including mandated benefits, disclosure requirements, and agent training standards, to ensure the product and sales process align with all applicable consumer protection laws. Explanation. This scenario is professionally challenging because it requires a health insurance professional HIP to navigate the complexities of specialty health insurance products, specifically long-term care, LTC insurance, while adhering strictly to U.S. federal and state regulations governing such products. The HIP must ensure that the product's features and the sales process align with consumer protection laws and ethical sales practices, particularly given the significant financial and personal implications of LTC coverage. A key challenge is balancing the need to inform potential clients about the benefits and limitations of LTC insurance with the prohibition against misleading or deceptive sales tactics. The correct approach involves a thorough review of the specific state's insurance laws and regulations pertaining to LTC insurance, including mandated benefits, disclosure requirements, and agent training standards. This approach is correct because it directly addresses the legal and ethical obligations of an insurance professional. Specifically, it ensures compliance with the Health Insurance Portability and Accountability Act, HIPAA, for privacy, and state-specific LTC insurance regulations that often require specific policy illustrations, consumer guides, and suitability assessments to protect consumers from purchasing inappropriate coverage. This proactive compliance ensures that the product is offered in a manner that is both legally sound and ethically responsible, prioritizing the client's understanding and needs. An incorrect approach that focuses solely on the product's premium structure without verifying compliance with state LTC mandates is professionally unacceptable. This failure constitutes a regulatory violation because it neglects the specific consumer protection provisions designed for LTC insurance, such as requirements for inflation protection or non-forfeiture benefits, which are often mandated by state law. Ethically, it is a failure to act in the client's best interest by potentially offering a product that does not meet statutory standards or the client's actual needs. Another incorrect approach that prioritizes speed of sale over comprehensive client needs assessment is also professionally flawed. This violates ethical principles of suitability and fiduciary duty, which require agents to recommend products that are appropriate for the client's financial situation, health status, and long-term care needs. Regulatory bodies often have specific guidelines on suitability for LTC products, and failing to adhere to these can lead to significant penalties. Finally, an approach that relies on generic marketing materials without ensuring they meet the specific disclosure requirements for LTC insurance in the relevant state is also problematic. This can lead to misrepresentation or omission of critical policy information, violating state insurance codes and federal regulations designed to ensure transparency and informed decision-making by consumers. The professional decision-making process for similar situations should involve a systematic approach. First, identify the specific type of specialty product and its associated regulatory landscape, e.g., state LTC laws, federal guidelines. Second, thoroughly research and understand all applicable federal and state regulations, including disclosure requirements, suitability standards, and mandated benefits. Third, assess the product's features against these regulations to ensure full compliance. Fourth, develop a sales process that incorporates all necessary disclosures, client education, and suitability assessments. Finally, maintain ongoing awareness of regulatory changes and product updates to ensure continued compliance and ethical practice.